Hey guys, so I decided to answer question 1. Do you think that dietary protein restriction is necessary for all patients with urea cycle disorders? So to start, the urea cycle is extremely important because it converts nitrogen as waste into urea, then takes it into and turns it into urine, which helps with protein metabolism and it helps break down ammonia. So someone with a urea cycle disorder is no longer able to break down that ammonia, and this is due to an accumulation of nitrogen, and a buildup of this can be extremely toxic, and it's known as hyperammonemia. And it's especially dangerous in the brain, and it can lead to possible brain damage, coma, or death. Rebecca's and Michaela's presentation on urea cycle disorders talked a lot about protein tolerance and intolerance in those with urea cycle disorder. So every human needs protein, especially in order to get the essential amino acids. And this is really important in children during their growing stages, in their adolescence, in order to grow correctly. And in the research papers that they provided, it seems like there's a fine line that hasn't been researched all that much on that lower level of protein intake in patients with urea cycle disorders. And it seems to say that many people with urea cycle disorders are able to still eat protein between, especially when they get older, between 0.8 and 1 gram of protein per kilogram body weight, and they don't seem to have adverse effects. But this being said, it's really dependent on the severity of the patient's disorder. So since it affects patients differently, I don't think that protein restriction is necessary for all patients with this disorder. Like Michaela said in her presentation, some people can go their entire life with this disorder and not ever be diagnosed. It's also important to pay attention to the quality of protein consumed, because this has an effect on those with urea cycle disorders. Plant protein over animal protein is more likely going to be better in this situation because it contains more of the essential amino acids, which is highly important for those with urea cycle disorders, as they might be deficient in those by not getting the healthy person's adequate protein intake. If they don't get these essential amino acids, the supplementation of those amino acids are extremely important in order for the body to function normally. And although the general recommendation is to avoid protein or follow a low-protein diet, I think that those who are educated in their disorder and are able to watch or control their protein intake with the help of a healthcare professional don't need to eliminate protein from their diet entirely. There are medications that help catalyze the enzymes in urea cycle and support optimum ammonia removal. And these medications include like sodium benzoate, sodium phenylsalate, didn't pronounce that right, and sodium phenylbutyrate. These drugs lower blood ammonia concentration by conjugation reactions involving acylation of amino acids. So basically, with the right treatment and the balance of protein intake, I don't think that extreme protein restriction is necessary with all patients, especially since each patient differs and there's not a lot of research on what that lower level of protein intake should be.